Hi, my name is Tasha, and I will be performing the administration of intradermal injection skill video today. To begin, you do want to make sure that you verify the orders from the provider. You want to verify the 6 rights of medication administration, which is going to be the right patient, the right drug, the right dose, the right time, the right route, and the right documentation. You are going to want to check and verify the orders in the AHR as well. I will be calculating the correct dose of we're going to use this today, the tuberculin purified protein derivative. This is going to be 0.1 ml intradermal, and this is just going to be 1 dose. At this time, I'm going to knock on the door, introduce myself to the patient, close the door behind me to provide patient privacy. I will confirm the patient's first and last name and date of birth, and if they happen to have a wristband, I will verify that on them as well. I will ask if the patient has any allergies or food medications, or if they have any seasonal allergies as well. I will also discuss the intradermal medication and its action and uses and side effects of the tuberculin derivative. This is going to be used to determine if there is any tuberculosis present. So it will either show a positive or negative reaction. This injection is going to be done intradermally, and we will inject about 0.1 ml. I will now let the patient know that they might feel a slight burning or a stinging sensation while the injection is being administered, which is normal, and it should subside shortly. Some of the side effects will include redness or irritation of the skin. You might have some bleeding or a little bit of bruising. Some adverse effects could include difficulty breathing or swelling of the hands and face. I will instruct my patient to report any of the adverse effects immediately. I will ask the patient if they have any questions. At this time, I'm going to perform hand hygiene. I will apply clean gloves. You're going to want to select the correct gauge and length of needle and the size of the syringe. We are going to choose a 25 gauge, which is a 5/8. You want to prepare medication. If you have a cap, you want to remove it. You want to wipe it down with alcohol to clean it. You're going to want to draw up with air the amount that you're going to be giving, which is 0.1. This time, you will carefully insert into the bottle and fill. You will now invert, and you will draw up your medication, which is going to be, again, the 0.1. You will also want to make sure that you get rid of any air bubbles and push up on the plunger if needed. You will want to make sure you select the appropriate site. You will verbalize if you see any lesions or any skin discoloration, and you will palpate for tenderness. If you see anything, you will use a different injection site. You'll want to clean the area with your alcohol swab. At the center of the site, rotating it outwards, and you want to do it about 5 centimeters, which is about 2 inches, so from inside to out. Okay. You do want to allow the area to dry. You will not touch the area once you have cleaned it, and you will not swipe with your hands for any air. You want that to dry naturally. You are going to want to hold your syringe with with a bevel facing up with your thumb and fingers. You will want to stretch the skin with the forefinger and thumb with the needle, like I said, up at a 5 to 15 degree angle. You're going to want to ensure that you have some resistance. You will insert the needle through the skin. And then you will insert the medication. So you will slowly inject the medication. While injecting, you will see a small wheel. This is going to be about 6 millimeters to 10 millimeters, resembling like a mosquito bite. You will let the patient know there might be a little bleeding. You will give them, some gauze or something to put on it. So while you're doing that, you will safely, you won't put a Band-Aid unless they need it, but you can put slightly like a gauze. You would want to put your safety on, and then you would discard your needle in your sharps container. You never want to recap these. Make sure it's a puncture-proof container as well. I will ask the patient if they have any questions. I will remove my gloves, clean up my mess, and I will perform hand hygiene. I will document the information in the patient's chart and make sure the patient has all their documentation. Thanks. Bye-bye.